Hi, my name's Megan, and today I'm going to talk to you about pertussis. How many of you know what pertussis is? Do you know that infants are the most susceptible age group to contract this disease and tend to end up in the hospital for treatment, sometimes resulting in death? As a mother of 3, I'm always worried about my children's health and well-being. As a NICU nurse, you're constantly educating parents and families on the prevention and transmission of germs to their infants' immature immune systems. According to the World Health Organization, pertussis is a highly contagious respiratory tract infection marked by a hacking cough followed by a whooping sound when somebody inhales. Pertussis, otherwise known as whooping cough, continues to be one of the leading causes of vaccine-preventable deaths worldwide. In 2017, the CDC reported 142,000 pertussis cases globally, with an estimated 89,000 deaths. That's over half of the people who contracted this disease died. Today I'm going to speak to you regarding the definition of pertussis, signs and symptoms, as well as treatment and prevention methods. Pertussis is caused by a bacteria known as Bordetella pertussis. This bacteria can live in your mouth, nose, or throat. It attaches to the lining in your lungs. Once the bacteria is attached to your lungs, it then releases toxins, causing our airways to swell. Coughing spells begin and may last up to 4 to 8 weeks. Pertussis is spread by droplets from person to person when we cough or sneeze. It is also known to spread when you are spending a lot of time in someone's breathing space, such as in the case with a mother holding an infant, a caregiver, or another older sibling holding an infant. Unfortunately, in these various situations, these people may not even know they have the disease and unfortunately pass it along to these infants. Now that we know what pertussis is, we will review various signs and symptoms that we can look for. Pertussis symptoms usually start out as a common cold, but can progressively get worse after 1 to 2 weeks. When an adult is first infected, they exhibit symptoms such as a mild cough, runny nose, or a low-grade fever. If an infant is infected with pertussis, they may not always have the cough that we talk about. Instead, they could have what we call as apnea, or they stop breathing. These early symptoms tend to last 1 to 2 weeks and resemble the common cold, making the diagnosis much more difficult for healthcare professionals. As the disease progresses, more traditional symptoms typically occur after your 1 to 2 weeks. Later symptoms include coughing fits, followed by the whooping sound that I had talked about earlier. Coughing fits typically are worse at night, and vomiting may occur during or after the coughing attacks. Exhaustion eventually sets in, and respiratory depression ensues. In China, pertussis is known as the 100-day cough. Next, I'll address the prevention and treatment of pertussis. Early recognition and treatment of pertussis is key to stopping its transmission. Pertussis may progress rapidly in infants, so a prompt diagnosis and treatment is vital for these babies. Treatment becomes ineffective late in the course. Early treatment with antibiotics will lessen the symptoms, decreasing the risk of secondary symptoms such as pneumonia, apnea, and encephalopathy from occurring. Most pertussis deaths occur in young babies who are unvaccinated or incompletely vaccinated. The best way to prevent pertussis is to keep your vaccinations up to date. This includes keeping up to date with your infant and child vaccine schedules, receiving your Tdap boosters, and if you are pregnant, making sure you receive your DTaP to protect your unborn child. Maintaining good hand hygiene, covering your mouth and nose, and washing your hands can also help to decrease its transmission. Today we have reviewed the definition of pertussis, common signs and symptoms, as well as appropriate treatment and prevention methods. Pertussis is a very serious yet preventable disease. I hope you will keep current with your booster and vaccine regimens, as vaccines are the tugboats of preventative care. Thank you.